Everyone, this is me, Dr. Moin, again with another video. If you find my videos useful, please like, share and subscribe. This is the video about the hypertension in the pregnancy. I will be giving you the history template, that is the overall, but specifically it will be for the chronic hypertension. So you can get your patient during your exam around at 10 weeks, at 12 weeks, at 28 weeks, 32, means she can be the pre-pregnancy patient, that you will get her for pre-pregnancy counseling. Still you have to do the information gathering. Other patient, you can get your patient in the first trimester of the pregnancy. You can get your patient in the second trimester or third trimester. So you should know about the history template overall. I will be giving you another history template that is for gestational hypertension and preeclampsia separately, but this one is specifically for the chronic hypertension. So first of all, you have to confirm the name and age of your patient. The parity is very important. BMI for the hypertension patient is very important. And blood group, you have to ask about the blood group in every patient who is antenatal, right? The pregnancy interval, you can ask about the last child born. Then you will ask since when she is having this hypertension. Is there any cause for the hypertension, like any endocrine disease, any autoimmune disease, or any other cause, or this is just an essential hypertension? How is her control so far? Is she taking her medicine regularly? If you get your patient at the pre-pregnancy level, then you have to ask, and she's planning for pregnancy, then you have to ask about whether the medical specialists know that she wants to get pregnant or she's planning for the pregnancy. Any investigation has been done on her so far, like ECG, echofundoscopy and renal function test. But once your patient is pregnant already, then you have to ask about whether the pregnancy was planned, whether the pregnancy was unplanned, or why you want to ask. Because it was a planned pregnancy, then you have to ask, okay, if it's a planned pregnancy, then you have done all your preconception investigations and optimized her health or no. Okay, this is your question you should ask. If it is unplanned, then you will just ask whether your medical specialists know that you want to get pregnant, or by any chance you have done your investigations like echo, ECG, all these previously or not. So let's suppose your patient is in the first trimester. Still you have to ask about all the preconception things. Then you have to ask about dating. The booking labs, is she taking folic acid, calcium and aspirin if 12 weeks onward? Then the anomaly scan has been done on her or no. Is she compliant with her medication? If compliant with her medication, what medication she is currently taking? Is she taking labetalol, or is she taking nifedipine or methyl-dopa? Then you ask about the dosage, that what dose she is taking. Has she done any dietary restriction like of salt? Is she following her regular antenatal visits? If you get your patient, let's suppose at 36 weeks, then you have to ask growth scan done at 28 and 32 weeks or no. If your patient is of chronic hypertension, then you should ask about signs and symptoms of preeclampsia, like sudden swelling of hands and feet, if she is having any scotoma or any blurring of vision, any epigastric pain, nausea, vomiting, or any changes in her proteinuria. Because we want to rule out the chronic hypertension with superimposed preeclampsia, then what are her preferences for her delivery? Now, if your patient is in the preconception time period, then you have to ask about ACARB. If she is already pregnant, then you should ask about the current medication, as I already told you about the labetalol, nifedipine, and all these things are very important. Because if she's taking labetalol, because it is the first line drug. If she's not taking, why she's taking nifedipine? Because it is contraindicated in patient with asthma, and the labetalol is contraindicated, so she's taking nifedipine. So you have to ask about the past medical history. So in past medical history, this you have to ask about asthma history as well, along with chronic kidney disease, autoimmune disease, or type 1 or type 2 diabetes. So obstetric history here, what is important? Last child born, because you want to know about the interpregnancy interval. Parity is important, and also recurrent miscarriages if she's having or not. Okay, social history is important, because you want to ask about smoking and then counsel her to quit smoking if she's smoking. Past surgical, you have to ask routinely. Then about her mental health, is she feeling down or depressed in the past 2 weeks or no? How is the support at home? This is all about the history template for your chronic hypertension. I will be sharing about the gestational hypertension as well as the preeclampsia. So I hope you like this history template. If you want to incorporate anything, you can write it down in between. This template will help you in counseling of your patient. You will know each and everything about your patient, what medication she is taking, whether she is having any medical history, whether she has regular antenatal visits, growth scans are done, anomaly scan is done, dating scan is available or not. So all these things are very important in your history. If you master this history template, we can incorporate only few points, and then the history for gestational hypertension and preeclampsia is also complete. Okay, thank you for watching.